Hello. Today we will talk about all types of eating disorders and their symptoms. The first type of eating disorder is allotriophagy. Allotriophagy is a medical term used to describe the consumption of non-nutritive or inedible substances. It is a rare eating disorder characterized by the consumption of non-nutritive substances such as hair, fabric, plastic, clay, earth, etc. People suffering from allotriophagy usually start consuming these unfit substances out of stress, anxiety, or as a result of other mental or emotional problems. For many, it is a way of self-regulation or a way of dealing with mental discomfort. Allotriophagy can lead to serious medical problems such as stomach or intestinal obstructions, digestive disorders, and nutrient malnutrition. Treatment for allotriophagy includes psychological therapy to address the underlying issues that underlie the consumption of unsuitable substances, as well as medical measures to address possible complications. The next eating disorder is diabulimia. Diabulimia is an eating disorder that occurs in people with type 1 diabetes. It is characterized by the withdrawal or reduction of insulin to control blood sugar levels in order to maintain or reduce weight. It is a condition in which a person uses their diabetic diet and treatment as a way to control weight, despite the negative consequences for their health. The main characteristic of diabulimia is a cycle of uncontrolled food intake that leads to hyperglycemia, high blood sugar, followed by deliberate withdrawal or insufficient use of insulin to lower blood sugar levels. This can lead to serious medical complications, such as diabetic ketoacidosis, kidney failure, retinopathy, and others. Treatment for diabulimia includes psychological support and therapy to help a person overcome a negative relationship with their body and food, as well as medical supervision and support to control blood sugar levels and avoid medical complications. The next eating disorder is drunkorexia. Drunkorexia is an eating disorder characterized by avoiding or reducing food intake to save calories for alcohol consumption. People who suffer from this disorder may consume excessive amounts of alcohol without proper nutrition, which can lead to serious health problems. This disorder can have serious physical and mental health consequences, including nutritional deficiencies, impaired mental health, liver disease, stomach and intestinal problems, heart disease, cognitive decline, and more. Treatment for drunkorexia includes psychological support and therapy to help a person change their relationship with food and alcohol, as well as medical supervision and support to restore normal eating and health. The next eating disorder is orthorexia nervosa. Orthorexia nervosa is an eating disorder that consists of a disproportionate preoccupation with healthy eating. People who suffer from this disorder become obsessively fixated on healthy eating and are convinced that only certain foods or food groups are acceptable for consumption. They may exclude a wide range of foods from their diet, strictly controlling the composition of food and the course of meals. This disorder can lead to malnutrition, nervous tension, and anxiety about eating, social isolation due to restrictions in food choices, and health problems due to insufficient nutrient intake. Treatment for orthorexia nervosa usually includes psychological therapy aimed at restoring a normal relationship with food, reviewing food beliefs, and helping to establish a balanced diet that meets the body's needs. The next eating disorder is obsessive-compulsive overeating. Obsessive-compulsive overeating, OCO, is a form of eating disorder where a person has obsessive thoughts or attempts to control food intake, but at the same time suffers from overeating and not meeting nutritional needs. People with OCD may have a need to binge eat constantly, which is accompanied by feelings of insecurity and stress. They may spend a lot of time thinking about food, planning meals, counting calories, or trying to control their weight. But at the same time, they cannot stop themselves from overeating. People with BED often feel shame and guilt about their eating habits, which can lead to social isolation and poor mental health. Treatment for BED includes psychotherapy, which aims to reduce intrusive thoughts about food and develop a healthy relationship with food. Behavioral therapy strategies can also be used to learn healthy eating habits and control binge eating. The next eating disorder is selective feeding disorder. A selective eating disorder is a type of eating disorder in which a person restricts their food choices, selecting only certain foods or categories of food, and refuses others because of strong emotional or psychological reactions. This disorder is often seen in children, but can also be experienced by adults. The main signs of selective eating disorder include refusal to eat certain categories of food, e.g., vegetables, fruits, proteins. Preference for only certain textures, colors, or flavors of food. Inability to eat new or unusual foods. Stress or strong emotional reactions when trying to eat unacceptable foods. This disorder can lead to malnutrition, nutritional deficiencies, and other health problems. Treatment includes psychotherapy aimed at reducing stress and anxiety about food, as well as gradually expanding the range of foods. The next eating disorder is pregorexia. Pregorexia is an eating disorder characterized by an unhealthy focus on food during pregnancy. Women suffering from pregorexia try to control their weight or overly restrain their food intake during pregnancy for fear of gaining weight or not recovering from childbirth. The main signs of pregorexia include preference for low-calorie or low-fat foods, avoidance of certain food groups, e.g., carbohydrates or fats, striving for perfectionism in weight and eating control, psychological stress and anxiety about weight changes during pregnancy. The negative consequences of pregorexia can include malnutrition, nutritional deficiencies for the unborn child, and psychological stress for the mother. In addition, it can affect the health and development of the fetus. The next eating disorder is night eating syndrome. Binge eating disorder is an eating disorder characterized by excessive eating at night, usually after waking up from sleep. The main feature of this disorder is the consumption of significant amounts of calories at night, often with feelings of compulsion or unlimited need. The main signs include constantly waking up in the middle of the night to eat, strong desire to eat after waking up, lack of appetite during the day or refusal to eat in the morning, exaggerated appetite or inability to feel full at night, feelings of stress or anxiety associated with eating at night. Nocturnal binge eating disorder can affect sleep quality, overall health, and quality of life. People with this disorder may suffer from fatigue, drowsiness, and other problems related to sleep difficulties. Possible causes of the disorder include stress, emotional distress, depression, or unhealthy eating habits.